I want to see the lots of the changes, and when you go out, at least you have to do at least 4-5 sessions at a day. Okay, not like this. You when you forget. No, I'm not feeling. If you create real passion, passion, and you will go more in the deep. Okay, and with your attitude, with your environment, you will get good result. That's more important. Mostly I am evening and morning I put the sound, but now little bit mind is going crazy, searching lots of things. Otherwise I put the sound, everything, the silent mobile, do not talk, all the relaxed patients. Okay, that's why I put speakers on this. And if some patient we are doing treatment like this, after the inserting needle, patient little bit feel sleepy and more relaxed. So you can turn off the light which is on the head, okay, and give the proper treatment. Moksha, when we come on the moksha, then uh, moksha give you 50% extra result. If you are doing a proper moksha, what you are doing, that is not moksha yet. That is just you are giving heat. Okay, one of my patients from Rajasthan only, I hired him just to do moksha in the Mumbai clinic. Okay, and he created a skill. If I, you know, patient is lying down and he is giving the moksha, so after feeling enough heat, patient's saying yes, okay, right? Okay, enough heat. He is doing the moksha. After few minutes, okay, he will go out and he's sitting there and patient is hypnotized and he is not giving the moksha and the patient is saying, okay, that deep sleep. Okay, so moksha is like moksha and a very unique technique. Okay, moksha can stimulate your whole fascia with one needle. I'll teach you some of the needle and moksha on the needle, then you see when you're giving the moksha, everything is going out, the negativity and the stress is going out from your body like this. And sometimes if you're not giving the like technique moksha, then you feel irritated, oh, pain, oh, it's heating, oh, too much heat. Okay, that's very different between this. How your body is moving, your fascia will catch like this. For example, this is mostly teaching more in the Reiki therapy. If your body moving like this, okay, with your body, when your eyes is closed, when you're moving like this, your fascia is moving with your body like this. Too fast movement, too fast confusion in the body. And if you're moving your body like this, patient will be very relaxed. Okay, so your movement directly your cosmic energy, patient's cosmic energy, they catch each other. When you are doing the testing also, do proper gentle touch. Patient is lying down, do exercise. Okay, when patient will see you, at least you have to, patient will think, okay, very good experience. When you're coming here, don't confuse your body, okay? Okay, one leg, okay, lift your leg. When the patient is lifting leg, one side leg is going more, one side down, right it. Okay. I'll tell you one thing, when I start my practice, I don't know how to read MRI and X-ray. That was my, honest experience. I don't know how to read MRI and X-ray. The patient will tell you before you are giving the MRI, doctor, I have L4, L5 sleep disk. Okay, and I'll take MRI. Okay. Patient didn't realize, I checked or not, I have anything like experience about this or no. Maybe I'll come and I'll check on Google. Just started. Okay. So what is the expressions you are giving, that is more important. Then you are checking everything. That's why I suggest if you are treating one patient, then I allow one patient and one therapist only. Okay, because the one another will not confuse you. Patient is more comfortable with one by one. Yeah. Okay, then go take each and every exercise. Write it. Then go and check the trigger points. Then insert the needle. Okay. When you insert the needle, what is the benefit of needle? How the needle will help? What is the problem inside the needle? Why needle is paining? You can explain that to patient. What I have to do, nothing, will fix with needle. You don't need to do anything, will fix with needle. Okay? Only those things, then the patients are like amazing. Okay.
they always ask for don't ask, but they just oh I put pain here.
Without asking, if you're giving them lots of the information, then they say, I don't care what I am. If you are able to fix, then fix it. Okay? So this is like this, when the patient are not asking, you are not explaining many things. Then when they will ask, if you give them genuine reply, they are happy with you.
Yes, sir. Proper examination and proper history is the main.
Proper. Yeah, when you are asking history, then go. For example, patients complain, I have like right knee pain. Do not go and touching everything. Just little bit with distance. Okay, since how long you had a knee pain? Okay, when it started, when I was playing golf, it suddenly starts slowly. And in which movements do you have more pain? When you're sitting or walking or climbing, okay? And is there a specific timing, like while you're resting, paining more? When you wake up in the morning, that time pain more? And this is the first time, so you have the same history past? Do you have any accident that? Okay, this is like genuine information. Which patient will think, okay, he really want to know about, and he will really diagnose everything. Okay, after that, where is exactly pain? Because knee is very big, right? Where is pain? Pain is here. Now, keep that our diagnosis sheet there, and just highlight when the patient is explaining, I find the pain here. Then highlight on the diagnosis sheet with red color, pain is here. Okay, so the green color and black color is for stiffness and green color is for weakness. Okay, then come this side, check to see the first the posture, then check the proper rectus femoris, what is medial is everything. Okay, after that you just say, this muscle is little bit weak, so that's why more pressure is going this sides. Okay, so we'll do acupuncture needle for this muscle to build little bit strength. Okay, so can we start your treatment? You want to ask anything on that? Then we can start. Alright?
So, sir, it is important to have this present history, then ask for the past history, then examination. After that, go for the patient.
History mostly good to build the bond between the patients.
It is
If it is the acute versus middle is or this chronic, the needle is the same, point is the same. Understand? Yeah. If the problem is chronic, again you will insert needle only here. If the acute, again you will insert needle here. That when you are taking the history, definitely he is giving more attention and he is taking my whole history. So maybe he will do his best because he knows everything. There's a bit more bond between the patients and doctor. And how you start that is also more important. Like when you're going to the patients, how are you? Is this your first time or you came before? Okay, if the couple came before, like last 2 days or maybe last week, okay, how are you feeling after the sessions? Is there anything improvements? Pain is increased, decreased, anything like changes? Mostly, I don't ask the improvement, only ask, is there any changes? Okay, because we know the honest review from the patients. How we talk, the patient reply like, is there good improvement? Patient, yeah, little good improvement. But that's not good for us now because we don't have the honest history, honest feedback. Then maybe we'll apply the same point. Then is there anything changes? Patient say, not really. Then we have to search a little bit more deep.
Raji, he told you, he said that in earlier days the pain was here and you must have done something wrong, meaning us. And because of that he had pain in his shoulder. So what was that actually? You think actually?
He had accident,
He had
big car accidents. So all muscle becomes like imbalance. He had lots of the problem in the spine here, which was the spine came out like this. Okay, if you still see the mild black mark is still there, before it was like this, the black skin is comes due to there is not enough good circulation of the collagens and the nutrition protein. Okay, there is no more patients for somewhere there is having a little black patch here. Black patch means skin degeneration like this. I had injury like this. That is not good circulation in that area. Okay, so now this pain is almost gone, very mild, and there is no problem in the movement. But this is like very chronic one. This is a very chronic, like knee almost gone like this. Okay, so
He's got about 70 years old.
yeah, around 70. Little bit whenever patient is growing a little bit old, they are saying their leg is, so they are like, can you fix this? Can you fix my this? Can you fix my this? They are little bit like this.
I thought it would be opposite. No.
This is a perfect. Okay. For example, 7% for the CO2 patient.
Yeah.
How are you suggesting? These people having a little bit belief system. Then I said, I know who is he is like a family tree guru. Okay, so I said, he will fix you, don't worry. Okay? Will not say, okay, don't worry, you will be fine. Understand? Now we'll go a little bit on the. Please, what we are discussing, try to follow that. Okay, that's very good for you and for our clinic also. When you're talking with genuine, quickly, passion is too excitement, don't go with excitement. Relax and don't suggest anything more. Only just focus on more needling, okay? And passion is like really safe, do not go and attach with emotionally attached. Okay? When you come on the like cosmic energy psychology, then you'll understand how that's destroying and stopping your behavior, like your healing system. Their body will not accept that. You are just talking to the child, okay? Yes, it's okay. For example, many times when I do the needling, person start to cry. It is good for you. The needle is, needle is trying to remove your all stagnated trauma and memory. In these conditions, it is used to say in psychology, seat of the leg. So it's used to say, for example, where some person like okay, it's used to say like this: when someone is crying and you are going there and you are holding them, so that means the patient was crying and feeling with emotions, and you hold and you stop them. That you did the some same thing, like, okay? So if someone is crying emotionally, give them their space. So they will understand how to handle the situation. And if you really want to help them, ask them some things. Okay, do the discussion, but do not give more emotional support. So basically, now we'll start with a bit of the upper shoulder.